As nurses, we assess the various developmental levels across the lifespan using the principles of developmental theories. We will explore three essential theories that help us understand human development across the lifespan. These are Erikson's psychosocial development, cognitive development by Piaget, and Kohlberg's moral development. These theories are crucial for assessing the psychosocial, cognitive, and moral well-being of our patients, which is an integral part of holistic nursing care. Before we go into these theories, let us first define two key terms: growth and development. Growth refers to the physical changes that occur in the body throughout life, such as increases in height and weight. Development, on the other hand, refers to behavioral, cognitive, and emotional adaptations over time. A combination of biological, psychological, and social factors influences how we grow and develop across the lifespan. As nurses, we assess these changes to provide comprehensive patient care. Erik Erikson, a psychoanalyst, expanded on Freud's theories to create a psychosocial model of human development. He proposed that individuals go through 8 stages of psychosocial development, each defined by a unique psychological conflict. How these conflicts are resolved influences a person's social and emotional well-being. This theory emphasizes the role of society and interpersonal relationships in shaping personality. Erikson introduced key concepts in his theory, including psychosocial crisis and virtues. Each stage of development presents a crisis, a conflict between two opposing forces. If the crisis is successfully resolved, the individual develops a virtue or strength that aids in further growth. For example, an infant must develop trust in caregivers to establish a sense of security. These stages guide us in understanding a patient's emotional and social challenges. Now let's look at Erikson's 8 stages of development. Trust versus mistrust. This occurs during infancy. Infants learn to trust caregivers who provide consistent care. Example, a baby cries when hungry and the caregiver responds with feeding. This builds trust. Autonomy versus shame and doubt. At this point, toddlers learn independence. Example, a toddler insists on dressing themselves, fostering autonomy. Initiative versus guilt. This is during the preschool age. Children develop initiative by taking leadership roles during play. Example is a preschooler organizing a game with friends. This builds initiative. Industry versus inferiority. During school age, children gain competence in skills and academics. Example is a child mastering math builds industry, whereas repeated failure may lead to feelings of inferiority. Identity versus role confusion. At this point, adolescents explore their identity. A teenager may try different hobbies to find their passion. During adulthood, young adults form intimate relationships. This is the stage of intimacy versus isolation. When a young adult is able to build meaningful friendships and romantic relationships, then intimacy is achieved. Generativity versus stagnation. During middle adulthood, these adults contribute to society. Example is a nurse mentoring new nurses, which exemplifies generativity. Integrity versus despair, which happens during older adulthood. Reflecting on life with either satisfaction or regret. Example is a retired teacher who feels fulfilled in her career experiences integrity. Jean Piaget is a Swiss psychologist who studied how humans acquire and develop knowledge. His theory focuses on how children construct their understanding of the world through interaction and experience. Piaget identified 4 stages of cognitive development, emphasizing processes such as assimilation, accommodation, and equilibration. There are key concepts Piaget introduced to explain how we learn. We have the schemas. These are mental frameworks that help us interpret the world. Assimilation. This is incorporating new experiences into existing schemas. Accommodation. Adjusting schemas when new information doesn't fit. Equilibration, the process of balancing assimilation and accommodation for cognitive stability. When a child sees a zebra for the first time and calls it a horse, this is assimilation. When corrected, the child learns that a zebra is a different animal and adjusts his understanding. This is accommodation. Piaget's 4 stages explain how thinking evolves from infancy to adulthood. The sensory motor, from 0 to 2 years. This is a time when learning is through senses and action. Example is a baby shaking a rattle to understand sound production. Pre-operational. This happens during 2 to 7 years, wherein symbolic thinking and egocentrism is developed, such as when a child pretends a stick is a sword. Concrete operational from 7 to 11 years, where logical thinking and problem solving happens. Such when a child understands that water in different shaped glasses is the same amount. Formal operational from 7 years onwards, when abstract reasoning and hypothetical thinking is developed, such as when a teenager debates ethical dilemmas. Lawrence Kohlberg extended Piaget's work to explore moral reasoning. He proposed that moral development progresses through 6 stages, grouped into 3 levels. Moral reasoning is influenced by cognitive abilities, social environment, and experiences. Kohlberg focused on how individuals make ethical decisions. His key concepts include moral reasoning, the thought process behind ethical choices; justice perspective, emphasizing fairness and rights; progression through stages, higher moral reasoning is achieved over time. Kohlberg's theory consists of 3 levels, each with 2 stages. Pre-conventional level during childhood. Stage 1 is obedience and punishment. The child aims to avoid punishment, such as the child following rules to avoid getting scolded. Stage 2, self-interest. This is acting based on personal gain. A child shares toys only when rewarded. Conventional level, from adolescence to adulthood. Stage 3, interpersonal relationships, seeking approval. Example is a teenager obeying school rules to gain teacher approval. Stage 4, authority and social order. The teenager follow rules and laws, like stopping at a red light because it's the law. Post-conventional level, during adulthood. Stage 5, social contract, understanding different moral values, such as supporting free speech even if one disagrees with an opinion. Stage 6, universal ethical principles, acting based on moral science. Stage 6, universal ethical principles, acting based on moral conscience. Example is a doctor treating an uninsured patient because it's ethically right. These 3 theories provide a comprehensive framework for understanding human development. Erikson's theory helps us assess psychosocial growth. Piaget's model explains cognitive progression, and Kohlberg's framework guides our understanding of moral reasoning. By integrating these theories into nursing assessments, we can better understand our patients' holistic needs. needs. Assessing psychosocial, cognitive, and moral development by collecting subjective data provides insight into a patient's developmental stage, coping mechanisms, and ethical decision making. Understanding these developmental perspectives allows us nurses to deliver patient centered care that aligns with individual needs and life stages. Subjective data refers to the patient's personal account of their experiences, perceptions, and emotions, while objective data includes measurable findings. Subjective data provides a deeper understanding of the individual's developmental status and psychosocial well-being. The importance of collecting this data includes differentiating between normal and abnormal developmental patterns, assessing a patient's ability to adapt cognitively and emotionally, understanding moral reasoning and ethical decision making, supporting nursing diagnosis and care planning. For example, a middle-aged adult struggling with career and personal relationships may be experiencing Erickson's stage of generativity versus stagnation. By assessing this, we can provide appropriate guidance and referrals. Biographical data provides essential information to establish the patient's background and developmental context. It includes age and gender. This helps determine developmental milestones. Ethnicity and cultural background influences beliefs, health practices, and moral reasoning. Occupation and educational level. This provides insights into cognitive function and stressors. Marital status and family structure affects the emotional and social development of a person. For instance, a retired adult adjusting to post-career life may experience challenges in psychosocial identity, requiring assessment of coping mechanisms and social interactions. When gathering biographical data, it is important to ask open-ended questions and allow the patient to share their experiences. Examples include, how old are you? This helps assess cognitive function, maturity, and communication skills. Where were you born? How long have you lived here? This determines cultural influences on development and values. What is your highest level of education? This assesses cognitive development and potential health literacy for years. What is your occupation? This identifies exposure to stressors, cognitive demands, and social interaction. For instance, a young adult in a highly demanding profession may struggle with Erickson's stage of intimacy versus isolation, requiring support in work-life balance and relationship. The history of present health concern, focuses on the patient's current symptoms, illnesses, or psychological distress. Understanding their perception of their health helps determine the cognitive and emotional response to illness. Key aspects include onset and duration of symptoms. This determines whether the issue is acute or chronic. Impact on daily life helps assess coping mechanisms and emotional well-being. Patients' understanding of the condition reflects cognitive development and health literacy. An elderly patient experiencing memory loss may be in Erickson's stage of integrity versus despair, requiring reassurance and support in processing life experiences. Some effective questions include: what brings you in today? This establishes the main concern from the patient's perspective. When did you first notice the problem? Helps differentiate between developmental transitions and acute issues. How has this condition affected your daily activities? Identifies functional limitations and emotional responses. What do you think is causing this issue? Assesses cognitive ability and self-awareness. A middle-aged adult with workplace stress might link their symptoms to job dissatisfaction, reflecting challenges in generativity versus stagnation. The personal health history provides insight into previous illnesses, treatments, and coping mechanisms or patterns. This section helps assess the patient's adaptation to health challenges and resilience. This includes the past illnesses and hospitalization. Determines long-term impact on psychosocial well-being. Use of medications and therapies. Assesses adherence and understanding of health conditions. Allergies and sensitivities. Identifies patient safety concerns. Effective questions for gathering personal health history include: have you had any major illness or surgeries? This helps assess resilience and adjustment to health challenges. Are you currently taking any medications? Evaluates health literacy and treatment adherence. Do you have any allergies? Ensures safety and effective care planning. Have you been hospitalized before? If yes, for what? Provides insight into past health experiences and coping mechanism. For example, a patient with a history of depression may exhibit signs of unresolved psychosocial conflicts requiring further assessment. Family history helps determine genetic and hereditary risk for psychosocial and cognitive disorders. It provides insight into patterns of illness and developmental influences. This identifies inherited conditions such as dementia or mental health disorders, reveals family coping styles and support systems, guides preventive interventions based on risk factors. If a patient's family has a history of cognitive decline, early screening for memory disorders may be recommended. Key questions for gathering family history include: do you have any close relative with a history of mental health disorder? Has anyone in your family struggled with decision-making or moral conflicts? What values were emphasized in your family growing up? A patient who is raised in a strict moral environment may exhibit conventional or post-conventional reasoning in Kohlberg's framework. Lifestyle factors are critical components of a person's development. By understanding a patient's habits and daily practices, we can guide them toward healthier choices and improve their long-term health outcomes. Key aspects of lifestyle and health practices include diet and nutrition. This impacts energy levels, immune function, and risk for chronic diseases. Physical activity and exercise. This maintains both physical and mental well-being. Sleep patterns and rest quality. These are essential for cognitive function, emotional stability, and disease prevention. Substance use increases the risk for chronic illnesses. Stress management and coping mechanisms affects emotional health and overall resilience to life's challenges. For example, inadequate sleep can lead to chronic fatigue, increasing the risk for hypertension, diabetes, and mental health conditions. As we assess our patients' sleep habits, we can determine if poor sleep is contributing to our patients' symptoms. To assess lifestyle habits effectively, we can use the following questions. How would you describe your diet? This question assesses the patient's nutritional intake and potential deficiencies. Do you engage in regular physical activity? This helps evaluate cardiovascular health, muscle strength, and mobility. How many hours of sleep do you get per night? This assesses the risk for sleep disorders and evaluates the impact of rest on well-being. Do you use alcohol, tobacco, or recreational drugs? This identifies substance use risks and their potential impact on health. How do you manage stress? This provides insight into the patient's coping mechanisms and mental well-being. A patient who drinks alcohol excessively may be at risk for liver disease, requiring further education and support. As nurses, we provide guidance on safe alcohol consumption, and connect patients with resources and support groups for management when necessary. In summary, biographical data provides context for psychosocial and cognitive development. Present health history identifies the patient's perception of their well-being. Personal health history provides insight into past coping mechanisms. Family history assesses genetic risks and moral influences. Lifestyle and health practices shape overall psychosocial and cognitive health. Assessing psychosocial, cognitive, and moral development is essential for holistic nursing care. By collecting subjective data, we can tailor interventions that support our patients' unique developmental journey. The essential components of assessing psychosocial, cognitive, and moral development in patient care allow us to understand that these domains of human development is critical for holistic nursing assessments. It allows us to offer age-appropriate care, identifying potential challenges, and support the patient's growth and well-being. As nurses, we frequently encounter patients at different stages of development. By recognizing these stages, we can guide our interventions and foster better health outcomes. Before beginning a developmental assessment, preparation is key. We need to ensure privacy and confidentiality. This creates a safe space for patients to share sensitive information. Establish rapport. Building trust encourages honest communication. For example, when a child is being assessed, using a calm voice and friendly demeanor helps alleviate fear. Use age-appropriate language. Adjusting our language ensures that the patient understands the questions and feels comfortable responding. A teenager may respond better to direct questions, while older adults may appreciate a more conversational approach. Consider cultural and personal values. Cultural sensitivity is vital. Understanding a patient's background helps us avoid misinterpretations and show respect for their beliefs. Explain the purpose of the assessment. Informing the patient why we are conducting the assessment reduces anxiety and increases cooperation. For example, when assessing a preschooler's cognitive development, using playful language like, "Can you show me how to play with your toys?" makes it easier for them to express themselves naturally. Developmental assessments focus on 3 domains. Psychosocial development by Erickson evaluates how individuals manage social and emotional conflicts at different life stages. Cognitive development, the Piaget's theory, examines how individuals perceive and process information. The moral development by Kohlberg analyzes ethical decision-making and sense of justice. What are the steps in the assessment process? 1. Conduct structured interviews using development-specific questions. 2. Observe behavior and responses during the interactions. 3. Compare findings to expected developmental milestones for age. 4. Identify concerns for delays and document findings thoroughly. For example, a patient in the sensory motor stage may not yet understand object permanence. When a toy is hidden inside or under a blanket, a 10-month-old should begin to search for it, indicating developing cognitive awareness. Erikson's theory outlines the 8 stages of psychosocial development, each representing a core conflict that influences personality development. Focus areas include trust versus mistrust during infancy. We need to assess if the infant has a secure attachment to their caregiver. During toddlerhood, autonomy versus shame and doubt, we need to evaluate a toddler's sense of independence, such as trying to feed themselves. During adolescence, wherein identity versus role confusion is the conflict, identify if the adolescent has a clear sense of self and future goals. We can ask these key questions. Who do you turn to for emotional support? How do you feel about making decisions independently? What are your personal goals? Example, a middle-aged adult experiencing stagnation in Erikson's generativity versus stagnation stage may struggle to find purpose in their career or family life, leading to feelings of dissatisfaction. Normal findings could include expression of confidence in their identity and decision-making, ability to form healthy social relationships, and able to demonstrate a sense of purpose and accomplishment. Normal findings could include struggles with self-identity and relationships, experiences of stagnation, purposelessness, or unresolved guilt, and difficulty trusting others. Piaget's theory focuses on how individuals understand and process information across 4 developmental stages: sensory motor, pre-operational, concrete operational, and formal operational. Focus areas for from birth to 2 years old, or the sensory motor stage, is object permanence and motor skills. From 2 to 7 years, or the pre-operational stage, egocentrism and symbolic thinking. From 7 to 11 years, or the concrete operational stage, logical reasoning and understanding conservation. During the 12 years and above, which is the formal operational stage, is the abstract thinking and hypothetical reasoning. Example is a 5-year-old who may struggle to understand that a taller glass does not mean more liquid, indicating they are in the pre-operational stage. Normal findings for this include age-appropriate problem solving and the ability to distinguish between real and imaginary concepts. Abnormal findings could include difficulty with abstract thinking in adulthood, lack of object permanence in infants over 8 months. Kohlberg's theory evaluates how individuals make ethical decisions across 3 levels: the pre-conventional, conventional, and post-conventional. Key questions that we can ask to assess include: why do you think it is important to follow rules? What would you do if you saw someone drop their wallet? Would you break a rule to help someone in need? For instance, a teenager may argue that stealing is wrong because it's against the law, while an adult in the post-conventional stage may say, stealing is wrong, but if it meant saving a life, it might be justified. Normal findings could include age-appropriate moral reasoning, empathy and social responsibility. Abnormal findings include justification of unethical behavior without remorse, making decisions solely based on punishment avoidance beyond childhood. The theories of Erikson, Piaget, and Kohlberg provide a framework for understanding human development in psychosocial, cognitive, and moral domains. This structured approach helps nurses identify normal and abnormal patterns, guiding appropriate intervention.